Go ahead.
All right. Hello and welcome. I'm Kristin Dempsey, and welcome to our little mini webinar on the substance use disorder curriculum modules. So some of you may know a little bit about this project that we started actually about at least 18 months ago now, probably close to a couple of years. And we're finally at the end and almost ready to distribute our modules. I'm going to go ahead and just talk a little bit today, and we'll probably spend, since it's a half-an-hour webinar, I'll spend a few minutes just giving you an overview today of what the modules are and how they work and our intention. And we'll answer questions. And then we have a couple other webinars following this one over the next couple of months. We'll actually do demonstrations and provide some technical assistance on how to use the module. So again, thank you for being here. I'm just going to show you a couple of slides here, then I'll show you a little more about the module. So I just want to put out here, this is actually a joint project through the Greater Bay Area Mental Health and Education Workforce Collaborative, which I am the project director, and the Relevant Family Foundation. And we started this again because we were really aware, try to get this a little more, there we go, better looking here. We were aware that what happens with lost substance use disorder treatment in terms of training, especially we're thinking in graduate school, is that people often go and attend one substance use disorder course, and then that's often the end of their training, in that substance use disorders as a topic isn't actually fully integrated into other aspects of the curriculum. And you can certainly say this about other topics as well, whether it be cultural issues, social justice issues, trauma. But we decided to start with substance use disorders, again, because that itself brings up so many other issues, certainly. And so the intention of this curriculum is to actually create discrete modules, and I'll talk about how they were created, that can be inserted into other training. So if I'm teaching a family therapy class, there's a little module on family therapy, for instance. If I'm talking about culture, we actually have some issues about intersectionality and cultural issues as they relate to substance use. We also have some issues about the culture of addiction, for instance. So that was really our intention, was to really find ways to explore and expand the substance use disorder curriculum. And so my goals for today is really to be able to introduce the modules and what they look like, to get some feedback from you all in terms of what's useful for you, to get your questions, to encourage the use of the modules. We're hoping that actually by seeing them that people will be more interested in using them. They are actually going to be published in March, so it's going to be a couple of months, but if we create some interest early on, then often people use the modules. And then finally, to establish some kind of ongoing technical assistance, in that people come and see me today and see the modules, they may be interested in calling back and getting some more support over time. So go ahead, excuse me, I'm going to show you the actual modules themselves. Excuse me as I kind of adjust my screen here. This is what our draft is looking like. And just to give you an idea of what we came up with, is that there's 9 modules. Now, as you know from probably doing this work, there could be 100 modules easily. There's so much rich topic areas and discussion and potential interest in so many things, because addiction, of course, impacts all of our lives. But we'd like to think that these particular modules were, to some degree, scientifically chosen, in that we did focus groups and ran surveys of providers, faculty members, and community members, people who have been in programs, people who have received treatment, their family members, to really look at and be curious about what seems to be missing, you know, from the perspective of people who teach, from people who learn, people in the field, and most importantly, from the people actually receiving services and their families. So these are the 9 topics we came up with. They're not really in any particular order in terms of the book. It's just kind of how we developed it. And so we're kind of proud of the fact that we really went through and took all these surveys and the feedback and did coding to look for themes. I mean, it was really some real, kind of had some real research structure to it. And then from that, we created each of the 9 modules. So this was actually intended to be for faculty. It was actually graduate school faculty to be able to use and to integrate into their teaching. And then as we started to do this, other people became really interested. So we had people in community colleges who teach various courses be interested in this. And of course, we've had providers. Probably a number of you on the phone are actually providers. And so there's probably no reason why some of these pieces could not be used as part of in-service or ongoing training. So just to give you an idea then, this little table of contents, we have culture of addiction, a little bit about motivational interviewing because there's such interest in MI, but it's really about engagement because that was a big piece about engaging folks. Intersection of multiculturalism and SUD, case management, co-occurring mental health and substance use disorders, relapse prevention, the skills of relapse prevention, family and community, adolescents and young adults, and co-occurring substance use in primary care. Because again, there's a lot of interest in people who work in integrated settings to have some of this training as well. So just to give you a little guidance for this particular booklet, it's 99 pages. Didn't realize you put that much in there, but I'll probably expand some because I'm already realizing there's a couple things I want to add. But each module kind of has a certain format to it. And what we tried to include was a little bit about where things belong in terms of a larger curriculum. And to also make that easier, we also created this. We call this, so you can see it, a grid. We call it the sample grid, and we're going to get it finalized. But what we did is we went through and looked at the different courses that are taught in the graduate program. And we started to do a crosswalk. So thinking like if I'm teaching a class on practicum, for instance, I can look through and I can see which of the modules might provide some information for me. So it's like, oh, there's a feature on engagement. So for a practicum, I can think about engagement skills, and that these particular examples will be focused on substance use disorder treatment, which is actually nice. I've taught practicum classes before, and it's nice to have materials that address different topics because it really expands your ability to teach in a way that's effective and inclusive. Oh, there's a little feature on case management. Oh, I don't usually necessarily teach about case management field practicum, but here's the actual module that shows me how to do that. A little bit about relapse prevention. We put that in practicum too because it's about skills and how to help people manage the behavioral issues around relapse. And then substance use in primary care. So that might be helpful about teaching people who might be working in an integrated care setting. So you can see down here a little bit, we have, if I can do that, yeah, we have other crosswalks. So I try to really think about all the different things, policy classes, right? There's people in social work programs, for instance, who do a lot more work on policy. I looked at micro and for children and for community mental health, really trying to think about all the different types of courses that we have in graduate programs. And again, I think as providers, there's some use for this. You can just be thinking about what kinds of pieces you might want to be adding into your in-service, for instance. So then each module has a piece around where it kind of belongs, and although certainly you could use any module in any type of your training. Move it down below here. We have student learning objectives, just again to be kind of in a consistent educational model. We want to be able to think about, well, what kind of goals are we trying to achieve by teaching this particular piece. We have here also pre and post tests. And so you'll see it says part 1 and part 2. What we did with these modules is we divided them roughly in half. So the idea is with part 1, it's usually like about half a typical class. So it's like maybe 45 minutes to an hour. So if I'm interested in incorporating a module, but I don't want it to take my entire class, because I have a lot of other things I need to teach that night, which those of you who teach, you know that challenge. I can take part of the module. Or if I want to do the whole class, if I'm teaching, you know, family therapy and I want to do the whole class, one whole class on family work, I can do module 1, or I can do the module and part 1 and part 2 and have 3 hours worth of material. So that's actually one of my favorite parts about these modules, is that you can apply them flexibly. And I'm rolling back here to the pre and post tests. You can do a pre and post test for part 1 and part 2. The thing about pre and post test is that those of you who know a little bit about you know, testing and research methods and such, you know that when you take a pre and a post test, just the fact of taking the test is a learning opportunity, and that it's not a perfect research tool in terms of exactly how much people are learning. So we're really putting the pre and post mostly just to help with the learning process. We know that testing is an evidence-based practice, it's going to help people retain information, but you won't necessarily be able to see, like, you know, with exactly all their increase in knowledge due precisely to each piece of instruction. I mean, it's not going to be that perfect, but it does provide a nice resource for students. And then just to let you kind of know, all of the modules are kind of organized in this way, where we have a pre-lecture exercise often, a little bit of lecture, and we have some of the outline, and then we have a lot of exercise. So what we're trying to do with each of these modules is we're trying to look at what is the essential information, just kind of the basics in terms of the lecture, and then we really try to give more opportunity for germane learning in terms of practice, observing videos, having discussions, small group discussions. So there isn't a lot of you know, heavy lecture material necessarily. What we also did is, because one, there's no point in reinventing the wheel, but also there's a lot of good, well-researched, evidence-based work out there that's in the public domain around some of these topics. So we did our research and used a lot of SAMHSA tools. You'll notice a lot of the links are links to places that are either in the public domain or active, you know, kind of live, open access internet sites that people can use. And these will probably need to be updated over time, but the idea is to really help providers and faculty be linked up with some really relevant, helpful material that's out there in the community. So that's really kind of how things are put together. And then we have some references. Some of our modules have more references than others, but you can certainly see there's particular links. And one of the things we want to do in our upcoming webinars is we want to get a chance to actually help you kind of go through some of these particular modules and to see how it works or how it feels. So I would actually be in a position of being the instructor, so to speak, and just kind of running you through an exercise. And then, of course, be open certainly to feedback, but just to give, you know, a sense of what this looks like and how this might, you know, be useful. Kind of given that, what I would like to do now, just about half of our time is over, I really wanted to give people a chance to ask some questions. I'm just going to put this down here for a second. And are there any questions yet for me about any of this aspect of the module?
Kristin, I don't see any questions in the question box. I'll go ahead and, why don't, if you want to ask a question, click on the button to raise your hand, and then I can unmute you one at a time. Otherwise, we'll get a lot of background noise.
Okay, well, people are coming up with some questions. People are raising their hands, we hope. Just to give you a little sense of this, we're going to have these upcoming webinars on February 21st and March 21st, and that'll be Family Systems on February 21st, and then March 21st is the Culture of Addiction. And again, just to give you some sense of this while people are contemplating their questions, it was really interesting to actually go through and do some of these interviews about what people want. So it's like, you know, why do family systems, and why do we have that? It seems like it's a logical place to insert some substance use treatment, to be sure. But as we started to interview people, especially consumers and family members, there was there's a lot of concern about how to involve families in treatment, and a lot of interest in that. And it was really interesting to certainly get the feedback from people who've been in treatment, because there's some of our systems are set up to not necessarily involve families, and others are. Other programs are really well involved, but even in our training, we don't necessarily, again, integrate some of these ideas of how, addiction can play out. And the second one on culture of addiction, that came up a lot in terms of, I don't feel like people necessarily always understand where I'm coming from, and then when I get sober, it's harder for me to integrate in the community, and I'm not quite sure how to do that, even how to talk to my therapist about my background as somebody who has a history of using. So it's very interesting to explore some of these pieces. And another thing that also came up was some thoughts around, well, can I have this, or people wanted to go ahead and put a lot of information into a regular substance abuse class, which would be great. But again, the intention of this particular module is to really expand some of the training and interest in this topic outside of your typical substance use class, and actually bring it into your other courses, so it's really expanded in terms of training. And if people have questions too, and some of you might, about how to consider using this in a in-service situation, I'm certainly happy to take those questions as well. Oh, okay. Looks like there's somebody.
There's a question. Can you see it, or do you want me to read it?
Yes, you could read it. That'd be great, so I don't have the whole question.
Sure. This is Bernadette, Stanislaus County, and she asked, will the modules be available at all times, or
yes,
will it's run at a set time date that we will have to register for, like a class?
Oh, okay. Well, so if you've registered, if you're here today, as far as these actual webinars, you're actually registered for all three. So there's that piece. And then Jeff also has a question too. I think if you guys have the same question, is when can we get the module? So
yeah.
Part of what I'm doing here is getting some feedback from you. If there's just really just a chance to be able to run through some of these exercises over the next couple of sessions to see if there's anything I need to adjust. But we're also going through improving and making sure just the last minute things that need to be done. That little crosswalk I showed you needs to be integrated, and we're pretty much done with that. But we're planning on a publication date of March. So the fact that you signed up for this webinar, you're going to be on our list. So you will definitely get it. We'll send it to you. Also, we come for the February 21st and March 21st webinar. I will make sure to have either distributed or in the handout box that's usually part of the webinar, a copy of that particular module. So you'll actually get those modules the actual day of the webinar. And actually for March 21st, we might actually already have it published, the whole thing, and I just go ahead and put the whole thing in the chat box. So you'll definitely have access to it within 2 months, which is good because you're asking me about this. Makes me have to speed up my editing process because, you can edit something forever, especially me. So I am looking forward to getting that done. Thank you. Any other questions? Oh, thank you for that. Thanks. Just another piece, I suppose, as we're kind of looking at this, and if you're thinking of another question, is the module itself, as you're considering doing these modules, put this up here again, you have an opportunity here. Let's see if I can't get this to go. Some days it's, there we go. As you're doing this particular module, you're kind of looking through these pieces. You can, I'm just going to give you a little chance to kind of slowly scroll through this. This is first the culture of addiction. You can be thinking about how might you use some of this in the context of your in-service training. So, we also have here some of the motivational internet family. We have pieces on multicultural issues. case management, care management. So here I use tip 27 a lot. So you might even be interested now, just kind of looking at this, going online and just you can get it from SAMHSA, samhsa.gov, tip 27 if you're interested in substance use disorders and care management. But how care management provides connects to SUD. We have co-occurring mental health and substance use based on tip 42. So we have a lot of different exercises, as you can see, engaged. So when you get a hold of this thing, this is mostly what it's going to look like. Relapse prevention. This came up a lot for everybody. This idea of relapse is a really tough piece. So again, I'm going to put some of these pieces in here. Family and community. And that's our next webinar. We're going to do some exercise based on this. Adolescents and young adults is hugely popular theme. Then, more co-occurring and some of the substance and primary care. Here we talk too a lot about screening for substance use in primary care situations, which actually might be practical for people just doing kind of short-term interventions as well. And then I have a whole piece here looking at some of the primary care issues, some of the physical health concerns that develop as a result of addiction, basically. So that's tip 45. A helpful piece to know. And there we go, end of our 100 pages there. So again, this is a little review of what we have in store. And are there any other questions so far from anybody on the phone? Besides getting copies, which I certainly appreciate that people are interested in copies. Not the next thing I have is just our upcoming webinar, February 21st. The same situation. We'll probably be doing, kind of more actively involved in the exercise. And today is just more of an overview, so it's a little more high level, so to speak. And then we'll do something on the culture of addiction on March 21st. And then finally, just make sure you know about this is I have my slide here. If you have any questions or concerns or want to follow up, sometimes people also like to have me just come or connect with them at their agencies. And I'm glad to do that around this particular program. I can do that for the next couple of months if people want me to come by or to check in or do some feedback or do a demonstration. I am certainly glad to be able to do that. So there's my information if you have any questions about any of those pieces. Okay. Anything else? Any other last pieces or questions that show up? If not, I'm hoping that folks will be able to join us for a demonstration of one of the modules. That'll be February 21st from 10 to 10:30. Again, you are already signed up for it. But by having signed up for this particular one, you will be signed up for February 21st. So you will get a notification as you did today, and you'll just be able to follow the link and come on into the meeting. All right, so are there any other messages for me?
I don't see any questions or hands raised.
No questions? Okay. So people know how to find me, and if you come February 21st, you will definitely receive the Family Systems module. I'll make sure you have that so you can follow along and participate. And I look forward to seeing you then. Hope to see you in about a month. Thank you very much for attending, and see you then.